Welcome everybody. With you, Dr. Magdy Abdel, consultant of infectious diseases, hepatology, and gastroenterology. Our topic today about a new variant called doomsday. This variant, doctors in China discovered it. As regard infection with syncytial and respiratory viruses, usually stable. Uh, Also, some coronavirus, which is called doomsday variant, is characterized by a rapid spread and has no disturbing effects like other variants. So, the symptoms of the new variant may extend to some symptoms between 5 and 7 days after catching the infection. So, therefore, uh, to exercise caution and take precautionary measures to avoid infection with the virus. The doomsday coronavirus variant has sparked panic after it infected about 250 million people during the month of December in China. Uh, about 37 millions in one day. So, some doctors related this new variant of coronavirus, which was named Doomsday, as a result of its rapid spread. So, what are the symptoms of this new variant? As regard the current coronavirus mutants in China, there are some symptoms are less severe and it has a lesser impact on the respiratory system, but its danger lies in the spread of its spread amongst people. The Chinese Center of Disease and Disease Control and Prevention believes that 18% of the population has been infected with the doomsday variant. Also, the Daily Mail stated that hospitals were overcrowded and the morgue was filled, prompting hospitals in China to provide care for the infected on the streets and in front of the hospital. The reason for this is that they were unable to accommodate to the large number of patients. The newspaper added that nearly a million people are expected to die in China due to the doomsday variant in the coming months. There are, there are a few reasons behind the spread of the new variant in China. Most importantly, notably, is the low immunity, reduced precautionary measures for coronavirus, and reduced vaccination rate. So, Doomsday is a new variant of the coronavirus which broke out in China and lead to a worldwide closures later to curb its spread. As regards WHO, they expressed his deep concern about the unprecedented wave of coronavirus infections in China. Also, they asking for detailed information on the seriousness of the situation in order to make a comprehensive risk assessment of the situation on the ground. WHO needs more detailed information on the disease severity, hospital admissions, and requirements for ICU support. So, as regards this disease, we know that Omicron spread all over the world, but the symptoms considered is minimal. The patient may suffer from influenza-like picture, like running nose, fever, dry cough, and easy fatigability, weakness, but these conditions continues about 4 days or 5 days, and after that the patient relieves. Also, in this subvariant of doomsday, the same, the picture the same, but it differs from the symptoms rarely affected the lung. So, usually there is no respiratory failure or complication in the respiratory system. It looks like influenza like picture. And also, as regards the diagnosis, it is also like Omicron because it is subvariant from Omicron virus. Also, as regard the treatment, we can give paracetamol as for analgesia, and we can also the patient advised him to take rest, and we advise to all people all over the world to read masks and to follow the preventive measures, because in winter season usually the viruses, especially respiratory viruses, increase, and it is easily to infect other persons. So we advised the people to avoid crowded places. This subvariant doomsday is not dangerous, and the symptoms is minimal. But the spreading of this virus is very rapid, and also we do not take a lot of information from China. So until now, the subvariant doomsday, we have no information too much about this virus. So we have to take care from this virus until proof otherwise. Also, as regard the Omicron itself, if any child or student take infection, we advise rest in home to avoid spread the disease in school children. Thank you very much.